Gleneagles BGS Hospital, Kengeri, Bangalore, has achieved a remarkable medical milestone by successfully performing a highly complex dual lung transplant on a critically ill patient who was supported on ECMO for over 60 days. The 40-year-old woman, suffering from end-stage lung fibrosis due to interstitial lung disease, had very limited treatment options. In a race against time, donor lungs were transported from Mahadevpura to Kengeri through a specially created green corridor, with vital support from Bangalore Police and Namma Metro, ensuring minimal ischemic time. The life-saving transplant was led by Dr. Govini Balasubramani, along with a multidisciplinary team of expert surgeons, pulmonologists, and critical care specialists. Doctors stated that managing prolonged ECMO support and precise timing makes this procedure one of the most challenging in transplant medicine, usually seen only at select global centers. This successful surgery highlights India's growing expertise in advanced transplant care and gives the patient a second chance at life.
सब अच्छे हैं डॉक्टर ख्याल रखते हैं बहुत यहाँ हाँ मुझे ऐसा लगा था अब ऑपरेशन नहीं होगा मेरा मैं तो हार मान चुकी थी ऐसा लगा था
That is here and हम बहुत ही क्रिटिकल कंडीशन फेस करके आए हैं यहाँ पर बहुत ही वहाँ से एक्मो के साथ एयरलिफ्ट करना ये सब फेस करना बहुत ही डिफिकल्ट था हमारे लिए तो आफ्टर ऑल थैंक्स टू क्लिनिकल टीम एंड ऑल डॉक्टर्स होता तो वही है जो गॉड चाहता है लेकिन गॉड ने भी इनको बस यही अच्छे काम के लिए और इनको ज्यादा आगे इनका नाम हो बस यही थैंक्स टू ऑल थैंक्स टू क्लिनिकल टीम्स एंड स्पेशली डॉक्टर
along with my team Dr. Umesh, Dr. Manjunath, Dr. Sharanya and the other team members we have recently done a very successful lung transplantation at BGS Gleneagles. So this patient is from basically from Gujarat, Kutch area, and she has been suffering with almost 2.5 years, and she is mother of 2 child, and they are very young age. And without the lung transplantation, her survival is hardly 6 months. In fact, when she came to Mumbai for a further treatment, there they got registered and then waited for organ for almost 2 years. Unfortunately, they could not able to get the good organs. So during the waiting period, she had some kind of breathing issues and requirement of high oxygen support. Even with the high oxygen support, they could not able to maintain her oxygen level. So they need to put on ECMO support. She was on ECMO. It's almost 35-40 days waiting for the organ with the ECMO. Without the ECMO, our survival wouldn't have been there. So that ECMO has helped during for a transition period. And then with the ECMO, we have shifted her to Bangalore in an air ambulance. And shifting the ECMO patient in an air ambulance, it's very highly challenging. Not a simple transfer it is. So we have transferred her here. In fact, we at BGS Gleneagles waited for almost another 25 days to get a good organ. Fortunately, with the God grace, she got a organ alert from Bangalore itself. So our team went and assessed the organ. It was looking good. Then we decided to take the organ for her. So the challenge with the lung transplant is one is the ischemic time. That is a major concern in every organ. So we have to do within 7 hours. So we have taken up the challenge, and we just channeled out how to bring the organ very fast from the donor hospital to the recipient hospital. So we requested the Bangalore police and also the metro to transfer the organ in a metro, and this is the first time to transfer out from there to here. That too in the peak hours. Normally, if you transport by a road, it takes at least 2 hours. In lung transplant, every minute is a very important factor. So within 1 hour, we could able to get the organ here, and we have successfully done this transplant. See, the lung transplantation normally in India, there are very limited hospitals doing here, and that too only in South India, not in many in northern India, because probably there is not much of donations happening in the northern part of the India. Most of the donations happens only in Tamil Nadu, Andhra Pradesh, and Karnataka. So these are and Telangana. These are the four states which have a good donor pool now. Probably because of the active participation by the government, and also the public awareness has been created much here when compared to the northern part of India. And most of the lungs, even the donor, if there is 10 donors are available, all 10 donors donation of the lungs cannot be utilized, because only 2 or 3 only will be a good organ. Most of these are almost in a brain dead people. So in India,
George Anta. I'm heading the Department of Physiotherapy in Gleneagles Fortis Hospital in Bangalore. Physiotherapy and rehabilitation is most important. Maybe thinking the understanding of the common people. Okay, surgery ಮಾಡಿಬಿಟ್ರೆ ಎಲ್ಲ ಸರಿ ಹೋಗುತ್ತೆ ಅಂತ ಒಂದು ಅಪೋಹ ಅಲ್ಲ ಅದು. It's most important physiotherapy. We need to prepare the patient for the surgery. If the patient is fit for the surgery, the outcome post transplant it's easy. The patient can come back onto the foot or toes and to walk at the earlier stage. And also the medications which the
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ಮಂಜುನಾಥ್, ಪಲ್ಮಾಲಜಿಸ್ಟ್, ಅಂದರೆ ಲಂಗ್ ಸ್ಪೆಷಲಿಸ್ಟ್. ಸೊ ಇವತ್ತು ನಾವು ಇಲ್ಲಿ ಸೇರಿರೋದ್ರಿಂದ ಅಂದರೆ ಒಬ್ಬರು
ಕಾರ್ಡಿಯಾಕ್ ಆ್ಯಂಡ್ ಥೊರಾಸಿಕ್ ಸರ್ಜನ್, ಅಂದರೆ ಹಾರ್ಟ್ ಮತ್ತು ಲಂಗ್ಸ್ ಮೇಲೆ ಆಪ್ರೇಷನ್ ಮಾಡ್ತಕ್ಕಂಥ ಡಾಕ್ಟ್ರು. ಈಗಾಗಲೇ ಈ ಪೇಷಂಟ್ ಬಗ್ಗೆ ಮತ್ತು ಈ ಆಪ್ರೇಷನ್ ಬಗ್ಗೆ ಡಾಕ್ಟರ್ ಮಂಜುನಾಥ್ ಮತ್ತು ಡಾಕ್ಟರ್ ಗೋವಿನಿ ಅವರು ಎಲ್ಲ ಡೀಟೇಲ್ಸ್ ಹೇಳಿದ್ದಾರೆ. ನಾನು ಒಂದು ಹೇಳಲಿಕ್ಕೆ ಇಷ್ಟಪಡೋದು ಅಂತಂದರೆ, ಜನ ಹೆಚ್ಚಾಗಿ ಆರ್ಗನ್ ಡೊನೇಷನ್ ಮಾಡಬೇಕು. ಇನ್ನೊಂದು ಈ ಪರ್ಟಿಕ್ಯುಲರಾಗಿ ಈ ಸರ್ಜರಿನಲ್ಲಿ ನಮಗೆ ಕಾಣಿಸ್ತಂಥ ಕೋಆರ್ಡಿನೇಷನ್ ಏನಿದೆ ಬಿಟ್ವೀನ್ ಡಿಫ್ರೆಂಟ್ ಸಿವಿಕ್ ಏಜೆನ್ಸೀಸ್, ಬಿಟ್ವೀನ್ ಪೊಲೀಸ್ನವರು, ಮೆಟ್ರೋ ಮತ್ತು ಬೇರೆ ಅಥಾರಿಟೀಸ್, ಅವರೆಲ್ಲರ ಹೆಲ್ಪಿಂದಾಗಿ ನಾವು ಇದನ್ನ ಸಕ್ಸಸ್ಫುಲ್ಲಾಗಿ ನಾವು ಮಾಡಲಿಕ್ಕೆ ಸಾಧ್ಯ ಆಗಿದೆ. ಥ್ಯಾಂಕ್ ಯು.
ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ಗೌರಿಶಂಕರ್ ರೆಡ್ಡಿ ಮನ್ನೆ ಅಂತ. ನಾನು ಇಲ್ಲಿ ICU ಇನ್ಚಾರ್ಜ್, ಹೆಡ್ ಆಫ್ ಕ್ರಿಟಿಕಲ್ ಕೇರ್ ಮೆಡಿಸಿನ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್. ಸೊ ಅಫ್ಸಾನಾ ಪಡಿಯಾರ್ ಇವರ ಲಂಗ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಕೇಸಲ್ಲಿ ICU ಕ್ರಿಟಿಕಲ್ ಕೇರ್ದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್ ರೋಲ್. ICUದಲ್ಲೇ ಅವರು 30 ದಿನ ಪ್ಲಸ್ ICUದಲ್ಲೇ ಇದ್ದರು. ಎಕ್ಮೋ ಅಂತ ಅಂದರೆ ಆರ್ಟಿಫಿಷಿಯಲ್ ಲಂಗ್ ಮೇಲೆ ನಾವು ಅವರಿಗೆ ಮೇಂಟೈನ್ ಮಾಡ್ತಾ ಇದ್ವಿ. ತದನಂತರ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆದಮೇಲೂ ಮತ್ತೆ ICUಗೆ ಶಿಫ್ಟ್ ಮಾಡಿಕೊಂಡು ಅಲ್ಲಿ ಇನ್ನೊಂದು 15 ದಿನ ಇದ್ದು ಗುಣ ಆಗಿ ಅವರಿಗೆ ಹೋಗ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಇದೆಲ್ಲದರದ್ದು ಒಂದು ಟೀಮ್ ಎಫರ್ಟು. ನಮ್ಮ ICU ಒಂಥರ ಕ್ವಾರ್ಟರ್